So we start with normal sexual differentiation. What happens? Now, this is just a table to put it all together. Okay. And where do you want to read this? I always tell you my references. What is the best reference? Which book should you read? Because I always believe that books are to be read. Okay. Don't look for shortcuts once you've entered post graduation. We are there, of course, to help you and tell you which books to read, but do make it a habit that although we are simplifying everything for you and giving you everything, handing it down, but always make it a habit that okay, ma'am has taught this topic, let me go back and also read it from the book once. You pick up so many other things. Read it like a storybook. Don't read it like you're going for the exam. For the exam, we will give you much more material to narrow it down. But read a book. That's very important. Okay. So this book, I love this book. The book is Speedoff. Okay. Speedoff's book for reproductive endocrinology. Initially, it will seem difficult to read. You will find it very difficult to understand terminologies because there's a lot of pathophysiology in this. So it may seem a little boring, but this chapter is given, in fact, all chapters are given very well, but this is one specific chapter which is given very brilliantly. Okay, so this is a very important must read chapter from here. And it goes into a lot of detail. That much detail may not be required, to be very honest, unless you're doing a super specialty in endocrinology. But it is important to understand, and as I said, read it like a story. That's what, if you read it from the point of mugging up or rectifying or learning things, then it becomes difficult. If you just read it casually as a story, of course you have to have time for that also, I understand, but if you do get the time to go through this chapter from this book, so this table is from there. Okay, and what it says is that the genetic sex, that is 46XX or 46XY, determines the gonadal sex. So what is the first thing what is the initial thing when the embryo is formed? What will determine whether this embryo is going to have a testes or an ovary is whether it is 46XX or 46XY. That is the genetic sex will determine the gonadal sex. Okay. The gonadal sex is then what's going to happen from the gonads. Hormones are going to produce, some hormones are produced during fetal development, and these lead to sexual differentiation of external internal genitalia. And this is what we assign when we see the baby at birth. This is what we assign, and this is partly responsible for gender identity. Also, hormones are produced from the gonads at puberty, and this leads to secondary sexual development. And this also, some arrows haven't come here. So this also ends up helping in identifying the gender of the individual. And also at the same time, the brain is also developing. And this is where the environmental factors come into play. And that also helps the individual decide the gender.